Hi, and we're back on TheJournal.ie with your questions. This afternoon we've got Dermot Good, the health insurance expert, here to answer your questions. Why health insurance? Well, lifetime community rating kicks in next week on April the 30th, so if you're in your early or mid-30s in particular, this is going to be of interest to you. So we have tons of reader questions that we were sent in since last night. If you still want to get in touch, you can email them to news@TheJournal.ie, and at the end of this session, in around time, I'll still be able to put your questions to Dermot. Dermot, thanks very much for coming in, first of all. So first of all, let's start big before we get to lifetime community rating. Why do we need health insurance at all? I remember being a younger man and getting through college and not even hearing about health insurance, and then realizing sometime in my mid-20s this was apparently a thing, something we all needed. So what are the benefits?
Yeah, the main reason why people buy health insurance is because they want choice. Okay, so if you think right now of the public system, there's a lot of coverage about the fact that there's 400,000 people waiting to get their first appointment through the public system. And even when you get through that process, then there's about 60,000 people waiting to access treatment in the public system. Now, when you get in, the public system is excellent. The problem is accessing those services for elective treatment. And that's the main reason why people buy private health insurance, because rather than going down to A&E, they want to be able to go to their general practitioner, who will send them to a specialist, and then that specialist will bring them in as their private patient. The other reason is that a lot of people want to be able to access private hospitals, and we have some phenomenal private hospitals in the country. So you have the Beacon on the south side of Dublin, you have Hermitage on the north side, and countrywide, and a lot of people, they want to be able to access those private hospitals. They want to be able to pick their own consultant and maybe get a private or semi-private room. So they're the main drivers. But even in saying that, even when we supposedly had lots of money, 47% of the population did not buy health insurance. So there's a lot of people quite happy to rely on our public system. But they're the main reasons why people buy. It's a subjective thing in terms of, I suppose, what's your priority when it comes to healthcare. A lot of people believe the public system should still treat me and look after me, and it does to a certain degree.
Okay. I don't know what lifetime community rating is in just a second, but first of all, let's just establish your credentials, because people will have seen these ads from the various health insurance companies over the last number of weeks, targeting people, younger people in particular. So we just want to establish that you're not affiliated with any company, and you can tell us a bit about the company that you are in charge of.
I'm an independent, let's just say, so-called expert on health insurance. So no, I don't work for any of the health insurance companies. I give fee-based advice to individuals and to employers on everything to do with healthcare. So for me, healthcare is not just health insurance. I mean, you now have DCare Dental and VHI doing dental cover. You have HSF Health Plan doing these medical cash plans. You have a company called VSP who provide cover for eye care in employers. So what I try and do is advise employers and individuals on everything to do with healthcare. And that's why the website is designed to give people information on everything to do with all types of healthcare treatments. But no, I don't work for any of the companies.
Okay, and TotalHealthCover.ie is?
Yeah, I mean, I set that up purely to give people a way. So right now, if you want to buy travel cover, health insurance, cash plans, you have to go on a myriad of different websites. So what I wanted to try and do is give people access to all that on one site. And also, I built a policy search facility, which is free, so people can actually click on that and they can pick from the top 70 to 80 plans, and this will show them the best plan, one from each provider. But then they go and talk to the providers directly and buy the product themselves.
Okay, so explain for us in a nutshell, lifetime community rating. What is it? Why is it?
Well, we have community rating in the market right now, and community rating basically means everybody pays the same, regardless of their age, their gender, or their medical history. But it's been seriously compromised because so many people have left the market. And this lifetime community rating measure is actually, the legislation is sitting there now nearly for 14 years, but they're enacting it now because the market has become unstable, and they need to get more young people into the market, which will, I suppose, sustain the market long term for everybody. And that's what they're doing. So this lifetime community rating means that from the 1st of May, anybody who's over 35 or over who doesn't have health insurance, if they join after May, they will be hit with a 2% loading for each year after that. And it's a permanent loading, so that there's no way around it. To give an example, a 39-year-old will now pay 10% extra on their cover, 44-year-old 20%, and so on. And as you get older, these loadings are pretty hefty. I mean, I was doing a calculation for a 54-year-old couple. They will probably over 30 years pay nearly €40,000 extra for a mid-range plan just on loadings alone. So people who are anyway interested in health insurance, they need to do it before Thursday week, otherwise these loadings will come into play.
Okay, so this is huge. This is in 8 days' time.
Exactly, and there's no discretion, there's no exceptions. If you join after the 1st of May and you're over 35, this will apply, there's no way around it. So a lot of people are not happy that they've been forced to make a decision, and I can appreciate that. But in the long term, I suppose, the long term interest of the market, so that health insurance doesn't go up 20 to 30% each year, and we see hospitals closing and so on, this is an important piece of legislation.
Okay, some questions we had around the office. The head of the Health Insurance Authority, which is effectively the watchdog body for the taxpayer in the area, said that people won't particularly benefit from these budget health plans that insurers are rolling out at the moment, and that we see advertised around the city and around towns. What do you make of these budget plans that are being offered at the moment?
I'd actually agree with that view. These budget plans, they really, in my view, they're only a means of avoiding the age loading. So, like, Dara, if you want quality health insurance, you will not get that for €400. You'd need to be spending double that. You'd need to be spending about €800, and that's a half decent plan that will cover you for public and private hospitals. But if you really want good cover, and I mean good cover where you have a low excess and you can get money back on all your routine expenses, that's triple that. You'd need to be spending around €1,200. So people need to be very, very careful. There's only so much you're going to get for €400. But, you know, for anybody, let's just say, watching this who wants to get on the ladder to avoid the loadings, then yes, look at those entry-level plans, because they get you on the first rung, and once you're in the system, there's no loadings. And you can always upgrade at a future stage. And people might be wondering, well, which plan should I join? All 4 providers have plans ranging from €395 to €449, so you could actually pick whichever one you want. There's 2 providers, Leia Healthcare and Glow Health, are the only ones that have plans just under €400, but all 4 have offers there, and they also have really good offers for children under the age of 18 in terms of either free cover or cover maybe costing €100. So there's good offers there to suit everybody.
Okay, so if you are 35 at the moment, and you just want to have this out of the way for a couple of years, if you're not secure about your income, this might be an option for you. So they shouldn't be dismissed altogether, is what you're saying.
No, and just to be fair to the plans, I mean, in terms of what they cover. So here's one of the biggest myths to do with healthcare. A lot of people think, sure, if I go public, it's free, and they won't charge me anything. Absolutely incorrect. Every public patient will be charged €75 per night, up to 10 nights in any 1 year. That's €750 either a child or an adult will have to pay. This plan fully covers that. And also these plans, if you end up getting treated privately in a public hospital, they can now charge you €813 for every night, even though you could still be in a public bed, but with a private doctor treating you. These plans fully cover that as well. So they do have limited value. But for me, health insurance is all about certainty of cover and peace of mind. So if I fall ill, I have choices, and I can go to my closest private hospital or public hospital. If you only have these entry-level plans, you don't have those choices. So it's a bit like somebody taking out car insurance who only buys third-party car insurance. It's very limited.
Right.
You need fully comprehensive.
Okay, great. And now we got loads of reader questions in, so I'm going to get to them in just a second. If you are just tuning in, Dermot Good, the health insurance expert, is with us for a while this afternoon. We got tons of questions overnight, and we're going to put some to him, but if you want to send some late ones in, you can get us at news@TheJournal.ie, and we'll put them to him in a few minutes. News@TheJournal.ie is where to get us. So Dermot, this is from Catherine in Kilkenny. I had health insurance from 2000 until 2010. I'm 43 now, but I can't afford to take up a new plan at the moment. What will this mean for me?
Well, what it means is that she's 43 years of age, so strictly speaking, 9 years over the loading, that's let's just say an 18% loading. But what they will do, so if Catherine doesn't join before the 1st of May, this loading will come into effect, but they will give her credit for the years that she had insurance. So I think she insurance for 4 years, that knocks 8% off the loading, so it'll halve the loading. So in as much as they can, they've tried to make the legislation fair. If you had previous health insurance cover, they will give you credit for that. If you were made redundant from 2008 onwards and you had to drop your health insurance because of redundancy, and you were in receipt of social welfare payments, they will give you 3 years credit as well. So unfortunately for Catherine, if she can't join now, there is a loading that's going to come into effect, but it will be roughly halved because she had previous cover.
And just to be clear, the credit that you get, it's not that you say you had health insurance for 5 years, it's not like you get a pass until you're 39 or 40. the percentage, it comes off the percentage of the penalty.
Exactly, it comes off the percentage. And to be fair, if somebody had health insurance for a long time and just let it go maybe for a year, they may find that there's little or no penalty to be paid. But for somebody, for example, who's had no cover for, let's just say their loading is a 10-year loading, which is 10 by 2, 20%. If they only had cover in place for 1 year, well, it just knocks 1 year off that. But it's very, very important when you're contacting the insurance companies after the 1st of May that you tell them. And the insurance companies have to share data, so they will go back and try and find out exactly when was Dermot Good insured and for how long. So make sure you claim those credits. But I would urge people, if they can at all, to try and get in before the 30th, rather than having, because these loadings, by the way, if Catherine stays insured for 20 years, that loading is every year for the next 20 years. And if rates increase, then it's the percentage is on the higher premium. So people need to bear in mind, it's a long term, this is not going to go away. So unfortunately for Catherine, she will have to pay a loading, but maybe not as much as she thinks.
Okay. From Lily, also in our comment section, I'm 34, my husband has had me on his policy for 10 plus years. If he should die at some point and I took out my own policy, will my premium skyrocket?
Okay, well, first I suppose answer to that for Lily is that she's 34, so right now if she joins now there's no issue. But she's raised a very, very important point. If you are currently insured, and whether you're insured in a policy in your own name or whether you are a dependent, an adult dependent on somebody else's policy, you don't have to worry about age loadings whatsoever. It will not apply to you. So for example, if God forbid her husband did pass away and she then took out a policy in her own name, she will get full credit for the time she's had on that policy. But once there's no break in her cover, she doesn't have to worry about age loadings at all.
Okay, a slightly different one here from Donald. I'm now 33 and I live overseas. I had health insurance when I lived here up until 2008. Given that I've lived abroad and plan to move back, what will the impact be?
Well, once again, the legislation has tried to make provision for this, and there's a clause in the legislation that says that if you return to Ireland, and if within 9 months of returning to Ireland, you take out health insurance cover, then regardless of your age, the loadings will not apply. So what I would say to Donald is that forget about it until he comes back, but when he does come back, he does not have to worry about the loadings once he takes out cover within 5 years, or sorry, within 9 months of coming back. The other issue though that is getting lost in a lot of this, a lot of people are focusing on what will my loading be. People need to realise there's also the waiting periods. So let's just say a 62-year-old who joins today to avoid the loadings, yes, they get the same premium as everybody else and they don't have to pay a huge loading, but because they're age 60, any pre-existing conditions will not be covered for 10 years. And they'll have a 2-year, well, they'll have a 12-month initial waiting period. So the older you are, the insurance companies, because they can't vary the premium, they are allowed to apply different waiting periods. So you have to wait longer before your cover comes into effect.
Right.
So that's a key thing that people need to realise. It's the loadings is one side of the coin, but you also have to be very very aware of these waiting periods. So yes, I can join and I will avoid the loadings, but if I have any existing conditions, I can't expect the insurance companies to cover them for a period of time.
Right. On the issue of I suppose people generally who are overseas, so say if you're in Australia, you've been there for 3 years, you're not planning to come back for a few years, if at all, and you're an Irish citizen, this isn't something you need to worry about until you get back here, and then you have a few months to sort it out.
Yes, that's exactly it. And in fact, it's even being interpreted more broadly than that. So for example, if I'm an employer, and a lot of employers are totally unaware of this legislation, they think it doesn't affect them, but it actually does, especially if they pay health insurance for their staff, because they need to decide, are we going to absorb this extra cost or not? But if I'm an employer and I'm recruiting from overseas, and I'm bringing in, let's just say, non-Irish nationals to work for my company, and depending on what jurisdiction they're recruiting in, a lot of these people will not have private health insurance cover, but if they put them on the scheme within 9 months of them coming to this country, then once again they will not be liable for any age loading. So yes, that's a very, very important caveat that's in the legislation, because we're getting inquiries all the time from people who are overseas who intend coming back, and they're wondering, do I join now, even though it could be 2 years before I come back here? They don't have to. They have 9 months when they return. Okay.
Some questions are emailed in from Jeanette. I'm 27, healthy and uninsured. My parents paid for my health insurance until I finished college. Does this count as having insurance before the age of 35? and exclude me from the surcharge. Well, I suppose she's 27, so it doesn't really apply to her at the moment. But I suppose that issue of being on your parents' health policy.
Yes, I mean, I would say the longer you can stay in your parents' policy, the better. But unfortunately, there comes a time where they will kick you off the policies. Absolutely. I got turfed off my parents' policy a long time back. But what I would say is, though, once you're under 35, it doesn't apply. So you really don't have to worry about it. So what I would say for this person is that, you know, if health insurance is not your main priority right now, well, make sure you do something about it before 35. But let's just say this person decided to join at age 40. Well, the time that she was insured on her parents' policy as an adult, she will get credit for that. Okay, so it will reduce the loadings. So yes, it's very important. What I would say to young people who are watching this, a lot of young people, health insurance is not a priority, and they think that public treatment is free, and they think they'll never get sick. I speak to young people all the time, particularly for sports injuries, so cruciate damage, ligament damage, all of that, and they join health insurance after they've suffered an injury, and they want to go to places like the Hermitage and Santry Sports Clinic and Beacon to get the best orthopaedic care, but they can't, and even if they join a policy, they've no cover for 5 years. So I would say to people, when you think of what it will cost, people don't realise one day in a private room, even in a public hospital, is €1,046, excluding doctor's fees. You can buy superb cover for €800, but you know, a lot of people have other expenses to worry about. But if you're under 35, there's amazing deals right now in the marketplace. But once again, if you are under 35, the loadings don't apply to you just yet. Yeah,
I suppose just on a more general question, if you are around that mark, and I'm asking this out of my own selfish interest, but say if you're around that mark, what are the options out there? I imagine there's a lot of people who are on a plan, haven't looked at it for years, aren't sure what it is or what it entitles them to. So what's out there?
Well, you've touched on two really important things there, Darragh. First of all, there are superb plans in the market right now from about €800. Okay, and what I would say to anybody, rather than trying to, you know, wage your way through 388 plans, decide on your budget. So if you decide, right, I've got €800 to spend, and then contact the insurance companies or your broker, or go online and basically tell them, I have €800 to spend. What is the best plan you can give me for €800? Now, there's no deals to be done. Some people have said to me, well, I'm showing my hand by telling them the amount of money. It doesn't matter. You're actually making them do the work for you. And you can say to the insurance company, whether it's a corporate plan or a nurse's or teacher's plan, I don't mind. Give me your best plan for that amount of money. And right now there are superb plans. I mean, if we have time at the end, I can throw out some of these. But the other point you touched on, which is really important, I would say 75 to 80% of all those people who have health insurance right now, they're on the wrong plans completely, and they're paying way too much for their cover, because plans evolve each year and there's new plans that come out, and sometimes the insurance company will take the plan that you're on, they'll copy it or clone it, and they'll put it out under a different name at a lower price. And if you don't watch what they're doing, you will end up staying on your plan and paying too much for your cover. So for anybody who's renewal, and thousands of people renew in April, they need to look at the options in the market right now, because they can also avail of these options. So that's really, really important. It's not just for those joining.
And I said, because people have these preconceptions about the market, that there are these secret, cheaper, better plans hidden somewhere, that there's maybe just a password you have to say when you call your provider. So how do you find out about these better plans? Can you just call your provider and say, listen, I know what you're up to, where are the good plans?
Well, you can. You actually can, and it's the way you phrase the question. So if you phone up, let's just say, your existing insurance company, and you tell them, this is what people do, they'll say, I can't afford the plan that I'm on, what do you recommend? And that's not the way to do it, because now you're allowing them pick whatever they want. And you might think they have 100 plans and they're going to go through all 100. Not at all. They'll pick maybe one of 5 or 6 plans for you. You are better off phoning the insurance company and saying, look, here's what I want. Now, I want you to go and check all of your plans and give me the closest equivalent plan to what I have. Excuse me. And I don't care whether it's a corporate plan or I don't care. I just want you to come back and make a recommendation. And if they then come back and recommend an alternative plan, the next question will be, okay, is that the best plan? Okay, because these calls are all recorded. And then get them to explain whatever differences there are, and that's it. Make them do the work for you. You know, you wouldn't walk into a car showroom and say, I want to buy a car, well what type, well what do you recommend? You know, and people approach health insurance the wrong way. You can go onto the HIA website, which is HIA.ie. Every plan on the market is there, and every special deal under latest news, it tells you all the special deals and special offers. So if you want to invest the time, and maybe have a large flask of coffee, okay, or whatever gets you through it, but the information is there. So there's lots of touch points for consumers to find this information. There's loads of websites. They can even get advice from brokers if they wish. They don't necessarily have to. You can actually do this yourself or talk to your existing company, but if you do shop around, and Dara, I can tell you the people who shop around get phenomenal deals. The people who expect the insurance companies to give them the best deals, they will often be let down.
And just so that those 5 points you might be calling your provider with, you compared it to shopping for a car. If you were shopping for a car, you might say, I want a 4x4, I want to drive up mountains, I want a sunroof, I want a convertible. If you're a reasonably healthy person who hasn't been to hospital for any pre-existing conditions, you might not really know what you're looking for. Can you just give us a vague idea of what you would be looking for?
Well, I suppose the 3 key points for me when somebody's looking for health insurance, number 1 is your budget. Okay, so I mean, you might want cover for the likes of BlackRock Clinic and the Mater Private for everything, but that comes with a cost. Okay, so what's my budget? So that makes it very, very clear in terms of, right, what's the parameters here. The second thing is there any key hospitals that I want to be covered for? So if I live beside the Beacon or beside Whitfield and Waterford, that might be, and that these are private hospitals, so that once again narrows the search. And the third thing is, what level of risk are you prepared to take on yourself? So in other words, some people will say, I don't want any excess, I want full cover, but it's a very simple equation. The more risk you take on, so if you take on an excess of maybe 250 per admission or 125, but the more risk you take on, the lower the premium they'll give you.
Okay.
And that's really what it boils down to. And once you are very clear on those three questions, then any insurance company, then after that, it's very, very simple for them to narrow the search, rather than you trying to waft through the 388 plans. The other point I'd make, Darren, as well, you probably heard these corporate plans that are in the marketplace. So right now, there are people watching this who are paying about $2,500 for their cover per adult. They should look at these corporate plans that are in the market now. They are half that price.
These are the secret plans that they have.
Yes, it's a very good way of describing it. I mean, what I would say is that the great thing about our legislation is that every plan that's in the market is available to everybody. So it doesn't matter if it's called the most bizarre name. If you like it and you see it, you ask for it specifically by name, they will give it to you. But they don't necessarily have to offer them to you. And what I like about these corporate plans is that they're designed for the big corporate employers, and they get the best deals. So they tend to be the most attractive plans. They're not for everybody, but I'll give an example. For €1,200 across all the 4 insurance companies, I mean VHI, PMI 3613, I think there's a plan called Connect, you're going to load these names now, Dara, Connect Care 100 with Leia. There's a plan with Aviva which is called BFit 2, and there's a plan called Better Smart with Glow Health. All fantastic plans at about €1,200. These plans give you half back on all your routine expenses. So the people paying the €2,500 don't get this. So for example, if you go to a GP or you go to see a physiotherapist or a dentist, you get roughly half back on all your expenses with no excess to pay whatsoever, and the other half you can claim tax relief on it. So that's why people, should look at those plans as well if they are shopping around, whether they're joining as a new member or whether their cover is up for renewal. They should always look at those plans.
Okay, great stuff. Now we've got a few questions coming in from readers, and some general ones to finish up as well. Are you covered by normal health insurance when you're out of the country, or do you need to get specific travel insurance? If you already have a policy here, in other words, do you need to spend 40 quid when you go to Brazil or whatever?
You should do,
yeah.
and I'll tell you why. It's a very good question. There are thousands of people outside the country right now who think they're covered by their health insurance, and they're not really. Most health insurance plans will give you €100,000 worth of what they call emergency medical cover whilst abroad. But for example, if you're going to the States or anywhere even further afield, that €100,000 is not sufficient. I had a case recently of somebody in the States, a tragic accident, and the bill alone for 3 weeks in hospital was €150,000. Most travel insurance policies will cover you for up to 5 to 10 million. And they also cover loss of luggage and flight delays and all of that. So I would always recommend, you can buy multi-trip policies from €20 to €50, and they complement your health insurance, and they actually give you a discount for having health insurance. So to answer that question, if you're, for short trips abroad, maybe for a weekend to the UK or France or whatever, the €100,000 that's built into your policy is probably sufficient. But I would never go abroad without travel insurance. I've had to use my travel insurance 3 times. So definitely recommend it, take out travel insurance when you travel abroad.
Okay, some questions from readers that have just come in the last half hour. Well, Dermot here. I'm 38 years old and never had health insurance. I'm looking at taking out cover for myself and my wife, but I don't know what I should be looking for. Should I contact a broker or provider directly? So 38 years old, himself and his wife, and they'll obviously be affected by this thing next week.
They will. They'll be, the adults, yes, if they're both, well, let's assume they're both 38, they'll have a minor, let's just say, loading to contend with. What I would suggest, once again, they can get, and they need to pick their budget, they can get really, really good cover for the adults from €800. And so even if they just wanted to pick a provider, they don't necessarily need advice. And I can tell you, for example, Aviva Health have an offer right now where you can get your children insured for €140. Okay, VHI have a half price offer on 4 of their plans where you can get children insured from €134. Leia have actually just in the last week launched an offer where I think they said they have 2 children where you can get the second child free of charge. So there's really good offers out there where, let's just say, you can get the whole family insured and you know, in a very inexpensive way. The other thing too as well, there's a really good tactic for reducing your costs: split your cover. So they could put the adults on a higher plan and put the children on a much lower plan, all under one policy. So yes, I mean, for 2 adults, 2 children, they can get good cover for anything from €1,000 to €1,500 and avoid the loading. So, and if they feel they need advice, there are loads of brokers out there, many of whom don't even charge for this. But you know, they should probably talk to the insurance companies first of all and see if they can make a decision based on that. If they're confused, well then maybe get advice.
Okay, another question that's just come into us. I pay health insurance now for 4 years and I'm very unhappy. Like most, I struggle to pay my bills. Even though I pay insurance, why do I have to pay my doctor or hospital again and then try and claim? Why can't it be that the hospital or doctor claim off the insurance? I still can't afford to go to the doctor or dentist. So is that the excess here?
Yes, and this is typical of you know, typical sentiment expressed by many consumers of health insurance. First of all, if you're admitted to hospital, one good thing about health insurance is that you just sign the form and everything is direct settlement. So you should never have to pay out. However, it sounds like this person, you know those corporate plans that I mentioned?
Yeah.
So if this person had one of those corporate plans, now it might mean an extra cost, they will get 50% back on all those routine expenses. X-rays, blood tests, scans, GP visits, consultants visits and so on. The problem that a lot of consumers have is that they're on old dated cover, like the likes of VHI's old Plan B and Leia's Essential Plus, and I can give examples across all 4. All good plans, but they're all very dated, too expensive, and they don't give you money back on your routine expenses. So this is the pitfall of not shopping around, you know. And hopefully, depending on what plan that inquirer has, they could, depending on the plan, be able to, believe it or not, save money and actually get better cover for their routine expenses by looking at these corporate plans. But it really depends on what plan they have. And once again, going back to our earlier point, €400 for these entry-level plans. There's no extras on these plans whatsoever. So in other words, there's no cover for routine expenses. They are just hospital plans. So if I have a sports injury and I'm going back and forth to the physio and going to my dentist and so on, these plans are useless. Okay, so people just need to be very, very careful. Look at the detail. What are you buying? What are you getting for your money? Get the insurance company to explain everything to you. Okay, and then you shouldn't find yourself in that situation.
Okay, and I suppose just to finish up, the deadline, as we said, is next Thursday, so it's tomorrow week. What do you think is going to happen? Do you think there's going to be a crazy rush to the phones? Do you think the system, as it is, will deal with it?
I think unfortunately it's the Irish psyche. I think there's a lot of people I've spoken to who do not want to part with their money until the 30th of April, which I understand. But they need to realise that there's going to be thousands of people, I believe, trying to either complete quotations or sign up by next Thursday. And what you can actually do is you can phone the insurance company today, you can set up a policy effective from next Thursday, and you can set your direct debit so the first deduction doesn't come out until the end of May. So you don't necessarily have to part with your money now. And then that gives you some breathing space. You also have a 2-week cooling off period from the 30th of April. You can change your mind. You can cancel the policy. You can upgrade it or switch to a different provider. But I think yes, Dar, what's going to happen is that there's going to be a lot of people trying to get through to the insurance companies, waiting in queues and so forth to try and get in by the deadline. And I think there are people who are going to miss this deadline. So I would suggest to people, don't wait till next week. Do it now and avoid the rush and get in. And that gives you don't have to be rushing a decision. If I'm spending €1,000 for my family, that's not a decision you want to rush, you know. So do it this week rather than, let's just say, putting yourself under unnecessary pressure.
And they're probably, the phone lines are probably up and late with these providers, I'd imagine.
I know they're all beefing up their call centres, and I think yes, they're delighted because they're going to get extra business, so they're not going to miss that opportunity. But you don't want to be making a decision under pressure, you know, on the second or last day. So I'd be saying to people, do it this week. Yeah,
great. Okay, Dermot, listen, thanks for coming up. Thanks for coming in. That's Dermot Good, health insurance expert with TotalHealthCover.ie. We'll be doing a longer version of this post later in the afternoon, and we'll be explaining some of Dermot's answers. But for the moment, that's it from us. So thanks a lot. Thanks, Dermot.
Thank you.